All right, welcome everybody. My name is Kim Wilbur. I'm the Marketing and Communications Director for the Chamber of Commerce. Thanks for joining us today. Before we get started, I just wanted to go over some housekeeping items so that everyone is aware. To reduce the sound of background noise, everyone has been muted. This webinar is being recorded and will be posted on our website. After the presentation, we will then allow people to ask questions. You can ask questions in two ways. One is raising your hand, which is down by the participant function, and then you can also ask your questions via chat. So either way, feel free to submit your questions. I'm sure the panelists will be happy to answer them. And now let's go ahead and get started. I'm going to turn it over to Courtney Thompson, our President and CEO, who's going to get us started.
Awesome. Thank you, Kim. Thanks, everybody, for joining us today. We've been enjoying doing these webinars, although we'd rather see your faces in person. This has been a good way for us to stay connected and stay engaged with our members and the community. So thank you for taking some time today to join us. I am excited about this panel discussion today. So although all of us would much rather not be learning these lessons and going through this the way we are right now, we have found that the silver lining of all this has been the way the community has come together. Very quickly, organizations, businesses, community leaders have mobilized and really pulled together resources, have pulled together group discussions. I know each of these folks can attest. We are on daily webinars, conference calls. Dan and Christy and I were joking last week. We don't know what a weekend is anymore because we're literally Saturday, Sunday trying to stay on top of what's going on. So I appreciate each of these being with us today to share what their organizations are doing. So we do have Tammy Radke with the Augusta Health Foundation, Christy Williams, the President and CEO of United Way SAW. They have recently changed their name in case you all haven't seen that, which is exciting. And Dan Lehman, who's the Executive Director of the Community Foundation of the Central Blue Ridge. So I'm going to let each of them introduce themselves, tell a little bit about their organization, and they're going to tell us what they do for their organization. We'll call it in normal times. So in non-crisis times, what they do at their organization. And then we'll hear from each of them about what their organization is doing specifically as a COVID response and what they're doing in the community. And then as Kim said, we will allow some time at the end for questions. If you have any questions during the discussion, feel free to put it in the chat and we'll circle back around with those as well. So I'm going to start with Tammy Radke with the Augusta Health Foundation. If you will just talk to us about Augusta Health and the foundation and what you do there, we'll take it from there.
Thank you, Courtney. I appreciate the invitation to join everyone today. My name is Tammy Radke, and it's my pleasure to serve as Vice President for Community Partnerships at Augusta Health, and also the Executive Director of the Augusta Health Foundation. Augusta Health, I'm sure many of you know, is a 255-bed acute care hospital here in Stanton, Waynesboro, and Augusta County community, also serving areas outside that community as far as Lexington, Southern Rockingham, Highland, Bath, Nelson counties, and parts of Western Albemarle. So we are grateful for the community support and partnership. In my role as Vice President of Community Partnerships, I have oversight of our triennial, every 3-year community health needs assessment, our community benefit program, which is mandated by the Internal Revenue Service, and it provides us with an opportunity to tell the community how the different things that the hospital does for the benefit of the community outside our normal healthcare mission. In addition, we also have a strategic funding process that the Community Partnership Committee of the Augusta Health Board does each year, and that is also part of my work. With my foundation hat on, the Augusta Health Foundation provides philanthropic support for patient care programs and services here at Augusta Health. Some of those things are, our deaf and hard of hearing program, some of the programs in physical therapy with special populations of patients in our fitness center, our cancer patients, our heart patients, and others. So it's really a privilege to serve in this role, and thank you again for having me.
Awesome. Thank you. We got to participate in a presentation that Tammy did a couple months ago with our Leadership Greater Augusta program, where they were talking about the needs assessment, and it was fascinating. So if you all haven't checked that out, I know it's on their website. We can put the link in the chat so you have that, but it's very interesting information for our community. So thank you, Tammy, for being here. She is a super busy person right now, so we appreciate her time. Next up is Ms. Christy Williams, the CEO of the United Way.
Hello, everyone. Thank you, Courtney and Kim and all of the wonderful chamber ladies for putting this together today. So I am Christy Williams, the newly appointed President and CEO of the United Way of Stanton, Waynesboro, and Augusta County, formerly known as the United Way of Greater Augusta. So you can find us both ways right now as we transition into our new name, which we're super excited about. We feel that it more properly reflects who we serve, and I've already had several questions say, oh, has the United Way of Waynesboro and the United Way of Stanton joined? And no, we've always been there, but people really didn't know, so we're excited about our new name. Under normal circumstances, the United Way kind of serves as a catalyst between large corporations and individual donors, and then the community in terms of different programming and community grants. Some of the programs that we offer internally are our VITA program, which stands for Volunteer Income Tax Assistance. This is a completely volunteer-ran program. It's funded through an IRS grant as well as some other community grants that we receive. And we provide free tax services for anybody in the community of Waynesboro, Stanton, and Augusta County that makes under $56,000 or less as a household. Last year, we completed over 1,200 individual tax returns. This year, we were on pace to complete 1,500. As of April 1st, we had completed and electronically filed 760. So with the everything going on right now, the tax deadlines have been extended to July 15th, and we are excited once society gets going again to resume that program and to continue to do taxes for anybody that needs to have them done. So taxes are not something that the community should be worried about at this time. We also do the Stuff the Bus program, which is during tax-free weekend, the weekend before school starts. We have a bunch of volunteers, over 300 volunteers over one weekend, 3 days. We stand in front of the Walmarts in Stanton and Waynesboro, and we collect donations and school supplies that are needed for the public schools. In 2019, we collected over $62,000 worth of supplies and donations that went to all 29 of our local public schools. And we ended our collection Sunday evening, and Tuesday when school started, everybody had what they needed at their schools. So we're really proud of that program that we do. We also do a Dolly Parton Imagination Library program, which is a early literacy program for children ages 0 to 5. This is, again, a completely free program. There are no income restrictions. So anybody that lives within Stanton, Waynesboro, and Augusta County who has a child between the ages of birth to 5 is eligible for this program. And they receive one high quality book delivered to their home every single month until that child is 5 years old. And the goal of that program is, if we were able to get every baby that was born in this area enrolled into this program, by the time they started kindergarten, they would have 60 high quality, age appropriate books in their own home library that are theirs. It's a great program, and we're hoping to grow that a lot more. We have increased in 2019 from 430 children to serving 860 as of last week. So we're really proud of that. And that is funded through a lot of community groups such as the Kiwanis Clubs, the Rotarians, and a lot of individual donors that really step up. And the Stanton Elks Lodge is a huge donor in that as well. So I had to give a little shout out to them. So on top of our internal programs, we also do community grants. Last year, we gave out $220,000 to 18 local nonprofits to help fund certain programs that they run, such as Meals on Wheels, different kind of mental health programs. So a wide variety of things, all that are then turned back into the community to provide services for free. So that is what we usually do. So that'll be it for me now.
Thank you, Christy. That is awesome. They do some really cool stuff over at the United Way. I'm sure a lot of you are familiar with them. We've been really fortunate to have a strong United Way in our area. And with Christy's leadership and this new name change to reflect it, I think she got tired of people confusing them with Georgia. We get that a lot between it being GA and there being in Augusta, Georgia. I know we get that sometimes too at the chamber. So our last panel speaker this morning or afternoon is Dan Lehman. He's the Executive Director of the Community Foundation of the Central Blue Ridge and also one of our chamber board members. Definitely appreciate him being here. He has been a busy guy these last couple of weeks. So Dan, tell us a little bit about the Community Foundation and what you do on a normal basis.
Well, thank you, Courtney, and I'm pleased to be part of this, and welcome to everybody who's participating. The Community Foundation is one of over 800 community foundations throughout the United States. We were all formed on a very simple premise that unlike private foundations like the Bill and Melinda Gates Foundation, which is created by one couple and it reflects their philanthropic wishes, community foundations are really based on the premise that everybody in the community has the opportunity to make a difference, and they can do that collectively through a community foundation. And that is done largely by the creation of individual endowments within the framework of our community foundation. And we have over 140 of those. And from those endowments, we award grants to nonprofit organizations, scholarships, as well as unique programs such as the Dahlgren Education Awards and its equivalent over in Nelson County, the Smith Education Awards. We entered this year with about $31 million in assets, representing all of those endowments. I am out of antacid, so I've stopped watching those balances. So I'm not exactly sure where that stands today, but we know things will eventually rebound. But fortunately, as those assets have continued to grow, we are now returning back to our community over $1 million a year. That's about $800,000 to $850,000 in grants to nonprofit organizations that are serving Greater Augusta County, as well as Nelson County and Highland counties. Over $100,000 in scholarships, both to graduating high school seniors as well as adults who are returning to advance their education. And then again, the awards programs that I noted before. We also work to engage the next generation in philanthropy. So about 11 years ago, our foundation created the Youth Philanthropy Council, which pulls together from every public and private high school within Greater Augusta County, 2 to 3 high school students, sophomores, juniors, and seniors that work collaboratively once a month to set priorities for grant making, create a grant application, interview nonprofit organizations, and then collectively determine how to distribute $25,000 that we give them for grant making. And we entered into that thinking that this was an opportunity for them to learn. What has been so wonderful is it's been our opportunity to learn from them because they go about these decisions in a much different way. They have a very unique perspective. And so we've really admired what they've done so much that with our community grants program, which is our annual program to which every nonprofit organization can apply for support, we put together a rather large grants committee, and we now bring into that grants committee members of our Youth Philanthropy Council to be working alongside other community volunteers as well as our board members. And they have added a lot to that process. And then, of course, we've been continuing with those programs this year, which we're right in the thick of now. But as every organization, this pandemic has required us to pivot very quickly and to begin bringing new resources to the community to meet the current needs. And I'm sure we'll be getting into that, so I'll pause there.
Wonderful. Yeah, the Community Foundation does really, really good work. And I also give a plug for Dan as a speaker on the grant making process and grant application process. he and Christina Casado, who works with him there at the Community Foundation, did a breakout session at the UP conference back in February, which feels like a lifetime ago at this point, but it was fantastic. So if you guys ever need to tap into those kind of resources, I'm sure Dan would be happy to impart some knowledge there. So thank you all for being here. Now we're going to switch gears a little bit, because each of these organizations, along with many, many others in our region, have really come together and pivoted quickly and been able to serve the community in different ways. You all know we're all going through this together, and things are changing so quickly, both on medical fronts and employment fronts and just everything we can think of. Things are changing so quickly, it's hard to stay on top of it. So these different groups have come together, sharing resources, getting information out to the community. We're having members who have had to stop what they normally would produce in their company. Blue Makers was a great example in Stewart's Draft. They, do the tulips and hyacinths and things, and they have switched some of their employees over to making masks and different things. So it's just been interesting to see people come together. And although we would rather not be having to deal with this right now, unfortunately we are, but I really feel like the silver lining has been seeing the community come together. People are reaching out to see what they can do for others. And I think we as a community are going to rebound a lot faster than other areas, because we're supporting each other and encouraging each other and able to come together and say, how can I help my neighbors? There's a group on Facebook that I'm sure a lot of you are part of, the Mutual Aid Infrastructure Society, that is literally just people from each of the localities coming together, sharing resources, asking questions. I mean, there have been people on there who are either ill or unable to get out of their homes for different reasons, and people are offering to go to the grocery store for them. So I think it just shows how amazing our community is, the way it comes together and takes care of its own. Perfect example, Dan's wife, Dr. Fox, is at Mary Baldwin, and they have offered to, obviously since they don't have students there, they are helping house residents from the Valley Mission who need to be isolated and help with the population there. So just great examples like that of the way our community is taking care of each other. So now I'm going to go back through and let each of you talk about, and I'm going to unmute all three of you, because a lot of this is kind of a joint effort between the different organizations along with the Chamber. I'm going to talk about the ways that each of your organizations is working specifically during this to reach out to the community, to share resources, what kinds of initiatives or funds, like the COVID Response Fund, the Community Foundation is in charge of, things like that. If you'll just kind of cover those and let everybody know what the organizations are doing specifically for the community during this time. So whoever would like to start there.
And why don't you lead off, since we'll lead off with the COVID-19 fund.
Okay, be happy to do that. Thanks. So when all of this began, we were tracking very carefully our counterpart organization in Seattle, since that's where we saw the first outbreaks in this country. So the Seattle Foundation was one of the first out of the gate in creating a response fund. And what we learned from their model, the two key ingredients, and those have proven to be extremely helpful to us in this process when we launched our fund. First one being you have to have control of the information and from all areas of the community, but also you need the cooperation of the community. So on March 16th, we launched the COVID-19 Local Response Fund. We are very fortunate that a very generous couple who have been associated with the Community Foundation since its beginning made a $100,000 commitment to create that fund. We've now raised a total of very close to $250,000 and have already been able to put 190,000 of that back into the community to meet the specific needs created because of the crisis. But as soon as we launched that fund, the very next day we began putting a coalition together. And this coalition represents different sectors of our community. First, what I call the philanthropic sector. So both Christy and Tammy are part of this coalition, as well as Anna Levitt representing Capsol. We have the private sector, and so we have Courtney representing the chamber and her outreach to the private sector, as well as other representatives of specific businesses. And then from the public sector, we have elected officials from each of the municipalities, as well as the Department of Social Services. And then along the way, as we have needed additional individuals, we have invited them into this rather fluid coalition. And we've been having conversations together once or twice a week since this began, to begin immediately pulling together the information we needed to set priorities, which we were able to do relatively quickly. And within a week's time, be able to get the first grants out into the community to address the needs that we were seeing. And I'll talk a bit later about what those pardon me, about what those needs are. But I think it's important to note that we continue to collect information, which is critical through this process, because the needs are continuing to evolve. And we're already beginning to now look at what is our community going to need as hopefully the curve levels out and begins to decline, and we look forward to emerging from this. There are still going to be unique needs created because of this pandemic that we need to address. And so we're not going to let up on the fundraising. We're not going to let up on assessing what those needs are and getting resources to where they need to go, and as quickly as possible.
Okay, I'll jump in there. Thank you, Dan. This is certainly just a mysterious time for everybody, and when I say that, it's terrible in the ways of what's going on with the economy and the fear and the healthcare and all of pretty much the fear that has this virus has driven into our society. But man, it's amazing how this community has come together, and I mean that from the perspective of the nonprofits, the school divisions, the locality, the local governments, and people of all shapes and sizes and income ranges have all come together for the one purpose of getting through this together. And I'm so proud to live here, and I'm so proud to be able to be in the position that I'm in to try to help. So, I mean, kudos to every single person in this area for either asking for the needed help and not having pride in that, and giving the help when they can. So I just think it's a time for, if we need help, we ask, and if we can give it, we give it. So in addition to the coalition that Dan was talking about, I reached out to the school divisions and really tried to get a good connection as to what their plans were. I mean, obviously, one of the biggest things during this pandemic is the fact that school is no longer in session, and we have a lot of parents that don't know what to do about childcare now. What are they going to do about their kids' schooling, and all the way down to internet access, or how are my kids going to get fed? A lot of kids in this community, they go to school because that's their safe place, and so now they don't have that. So how do we address all of those needs and make sure that the next leaders of our community, of our world, are properly taken care of and they feel safe and protected? And the Community Foundation and all of the nonprofits have really come together to address those needs in a very quick manner, and I think are doing a superb job about that. One thing that the United Way has done was to address the personal hygiene aspect and realize that a lot of these folks, they're not able to get access to the basic necessities like a toothbrush, toothpaste, soap, deodorant, shampoo, all of these things that we take for granted on a daily basis because they're there. But when somebody cannot go to the store because they're elderly population and they cannot get to the store, or they don't have transportation and they can't ride the bus now because of the population, social distancing things, or they can't leave all of their children at home to get to the store. These things, they get forgotten. And the line of repercussions from not brushing your teeth, that can lead to cardiac effects, and that can lead to long-standing health effects that then would fall into other categories. So trying to address these needs proactively rather than waiting for folks to say, I don't have this, is what we've tried to do. And we have put together 5-piece kits and 15-piece kits for personal hygiene. One is just your basic shampoo, toothbrush, toothpaste, soap, and deodorant. And then the other has some extended shaving products and things. And these will be going out with all of the school lunch programs next Wednesday. So a week from tomorrow, or today. Today's Wednesday. My days are so confused. And so those will be going out with the pull-up and also delivery for all 3 school divisions, Stanton and Waynesboro and Augusta County. And then they will also be available by request at any time. And then we have also partnered up with, Courtney had mentioned the mutual aid SAW group and the fantastic job that those volunteers are doing. And she's right, these are volunteers that are friends and neighbors. They have a lot of the faith-based community involved. People are just reaching out saying, what can I do to help? And so we have received a grant from the Community Foundation and have invested some of our own money into providing some gift cards for these volunteers to be able to help these folks get the groceries that they need at no cost to them. So this is, we just launched this program yesterday and feedback, or Monday, and feedback as of yesterday has just been amazing, that people are in tears. I'm just so grateful that, they were able to have diapers delivered or just, basic necessities that, they need. So we're really proud of that. We're also hosting a resource page. We've kind of transitioned our website to just be a COVID-19 resource page for the community. So right when you land on our website, what you can get to via UnitedWayGA.org or UnitedWaySaw.org, you'll see the first thing is, COVID-19 resources. And you click on that and it's a comprehensive list of different community things, resources that are out there, or they have the links that will then lead to a more detailed list. So for the different school divisions, lunch programs, Augusta Health, things like that. So we're just trying to keep up with the current needs. They change every day, every hour. We are receiving many phone calls and emails from individuals and groups letting us know what they're hearing that their community needs. We're working a lot with the faith-based community and addressing, making sure that there's no hunger and that, everybody has what they need to get through this time, taking it moment by moment. So we don't know what tomorrow will bring, but we're hoping that together, we'll be ready for it. And I'm pretty confident that we will be. So thanks. You're up, Tammy. You're muted. Yeah.
Hello?
There you go.
All right. I'm such a technology whiz. I just can't believe that happened. But anyway, I have a lot to tell you. Residents of this community and local businesses can be so proud of the way our hospital has responded to COVID-19. About 3-4 weeks ago, we began our incident command system where we have meetings twice a day at 10 and 3 to review the status of what's going on in the community, the status of the virus here in our community and in our state, as well as what we need to do to take care of our patients. We set up an assessment center at the Waynesboro Primary Care Urgent Care Center there on Lou DeWitt, and we have been assessing members of our community and also testing them for COVID-19. In the meantime, we're trying to get information out to our community via website and social media and other ways. We sent a direct mail piece about how to take care of yourself during this time, how to avoid the coronavirus if at all possible. And so we want our community to understand how to stay healthy, what they need, what precautions that they need to take. the leadership of the hospital and in the incident command, our physicians, our caregivers, nurses, housekeeping, nutritional services, they have all been rallying around COVID-19 and the preparations that need to take place. Again, at first it was how do we test our community and determine what is needed, what they need. But now we're also looking to the future, and that is we expect a surge. We expect that the peak of the COVID-19 virus in Virginia will be around April 20th. We know that we're a rural community, and so we may be a little bit behind that curve, but we are preparing, and we're preparing for the worst and hoping for the best. So our community can be extremely proud of the hospital and the way in which it has mobilized and had the community's and residents' best interest at heart. The Augusta Health Foundation has been busy trying to support our caregivers. There are lots and lots of needs, and as many of you know, supplies are limited. In the last 3-4 weeks, we have been reaching out to our business partners and churches and others asking for medical grade gloves, other personal protective equipment such as masks, N95, dust masks, any kind of medical mask or surgical mask that you might have in dentist or medical office, face shields, Tyvek suits, hand sanitizer. We were extremely low on at one point. We have gotten such a supply of that now. I think we're okay for right now, but we have had an outpouring from the community like I've never seen before. It's been extremely heartwarming. We've had woodworkers bring us N95 masks that they've had in their workshops. We've had churches come to us with hand sanitizer and gloves that they may have had. We have sewing circles that have mobilized, and they are making masks for us either out of cloth or surgical drape material. These are needed. Our caregivers go through them, many of them, in a day. So we're burning through them at fast rates, and so we need to have additional ones. We've had local businesses come and provide us with gloves and chemistry goggles and safety glasses and just so many things. Local restaurants have brought our caregivers pizza and food and beverages. It's been absolutely amazing how much our community cares about Augusta Health's workers on the front line and how much they want to support us. So we have been absolutely overwhelmed by that community support. In addition, we are part of what is called a private-public partnership for COVID-19 that began about 3 weeks ago. Gary Kreitzer from Waynesboro EMS and I are leading that effort. I'm really his administrative partner, if you will. And that coalition is really to look at the morbidity and mortality here in our community and try to lessen that minimize that as much as possible. Other members of that private-public partnership include our county and city administrators, Dan Lehman, Margaret Hirsch from the United Way, Mary Mannix, our CEO, Scott Just, one of our incident commanders and physicians, Mark Shields and Laura Jean Brand, who have been working hard at isolation and quarantine here in our community, Anita Harris from Shenandoah Valley Social Services, Laura Cornegie from the Virginia Department of Health, and Reverend John Peterson from Covenant Presbyterian Church, representing the faith-based community. So we meet once a week, and we have report outs from different groups that are tasked with specific tasks, and that has been great to see people come together in the community for the purpose of making sure that we're looking at the needs in the community. We're looking at resources and how we can better apply resources at this time. And as Dan said earlier, in the future, this is not going to end soon. And even after COVID-19, there are going to be tremendous needs in our community.
Great. Thank you so much, Tammy. I know that Courtney is having some internet issues, so but if you guys want to let us know what questions that you have, either by the chat function or just raising your hand, or you could just unmute yourself. Welcome back, Courtney.
Sorry,
So
yeah,
any
we're having
questions?
internet issues. We live in the boonies, so.
That's all right. So I was just telling them that we were ready for questions, and they can submit that either by the chat or just raising their hand. Go ahead, Lindsay.
So I'm Lindsay Walsh from Mary Baldwin University. A lot of familiar faces here. One thing I'm really worried about, because I help connect our student talent to employment, is just how you guys anticipate how our employment might change in the Valley, because we've been so lucky to live in a beautiful place and support a lot of visitors coming and host a lot of educational things. Since a lot of that's been on hold, what are ways that we can support those communities, and what opportunities do you guys think might be new and emerging from this?
And that might be good for Courtney and her staff to weigh in on first from the perspective of the private sector.
Yeah, so that's definitely a question that a lot of our members and business community obviously are asking. There are some businesses who are thriving during this time and are doing well. And I know it's going to be an ongoing question with the stimulus package, with the way that our area is responding to this. Hopefully, we will be able to see kind of a return to normalcy and normal business functions, pretty quickly. So I don't know if there's a great answer for that, but it's definitely one that a lot of businesses are asking and that we're talking about. We are very involved in the Virginia Chamber and different groups there, and it's kind of the same conversation that they're having across, the country really at this point. I do hope that with our area and the way it's responded, that we'll be a little easier to get back to where we were, because we obviously had a very low unemployment prior to all of this. So that's a great question. Definitely one that is going to be a continuing conversation.
And I would imagine that this being a worldwide pandemic, it has really thrown the supply chain into a complete and utter disarray. And I think it's going to take our country and all countries time for the supply chain to work itself out as different countries are exiting this pandemic or at different times. So I think we're gonna see the higher unemployment rates continuing probably for a good year or so after this is over, and that's just my opinion. But I do think companies are also going to be who are suffering losses at this time. It's going to take them a while to recover to the point where they're going to be comfortable getting back up to the staff levels that they were pre-pandemic. So I think it is going to be a challenge. But I think one thing that people who are seeking employment can learn from this whole situation is that one of the lessons we're learning is that people need to be thinking creatively, thinking outside the box, and also reassessing what assets they bring to the table, identifying where those assets could be best used, and being very proactive in making some things happen. And so I think people who are going to be seeking employment after this are going to need to take that same approach.
And I would just add that, as nobody really knows how this is going to, how we're going to rebound from this. And from the United Way's perspective, our position will be to help those folks that are seeking employment with everything that needs to be done for them to be able to go get employment, childcare, interview skills, things that people are going to need to get into the job market. Making sure that they have access to food and proper, housing and transportation, that, we're going to try to address those things so that they can get back into the workforce and get gainful jobs.
It's almost like you read my mind, Christy, because my next question was, as a community member, where do you guys see the gaps in some of the basic needs that people have, like housing and food? And what are ways that we as community members and leaders can help you guys make sure that our neighbors have those basic needs?
Well, and Lindsay, do you mean like right now in these basic needs, or as we kind of pull out of this and try to get back to normalcy?
I'm almost thinking more down the road, because it sounds like from you guys' responses that we've had a great ability of people, whether it's with their time or with their resources, to respond to our immediate needs. And then too, because of the pandemic status and how extensive it is, that people have been able to halt evictions and do some of those things. So my concern is more, you know, this summer and fall, when some of those protections or additional resources fall away, and people are still going to have a great need.
Right.
Well, I guess down the road is more of what I'm thinking for housing and food needs.
I think the number one thing, and I know it kind of sounds generic, but the number one thing our community can offer is kindness and empathy and support. You know, people are going to be in situations that they've never been in before. People who have always been able to provide for their families may not be able to do that in July and August. And so they're not going to understand, you know, what it's like to ask for help. And so I think the biggest thing our community can do is embrace them and support them and say, it's okay. You know, we're all in this together, and not, you know, imply any kind of stigma on community members that find themselves all of a sudden needing rather than being able to give. And I go back to the whole, if we're able to give, then give what you can. And if you need something, then don't be afraid to ask for it. But I think transportation, childcare, and just basic utilities and bills. You know, these folks aren't getting their electricity cut off right now, but in 3 months, they're going to have 3 months worth of an electric bill due. And so it's, you know, it's going to be, how do we address those needs at that time as a community? And we're trying to figure that out.
And I'll add to that point, Lindsay. I think things that organizations like Mary Baldwin and other educational institutions can be doing for the workforce is elevating the importance of financial literacy, personal budgeting, and making sure, as Christy said, when right now the protections are in place for people. There are evictions are on hold. Utility companies are not going to be turning off power and water and so on. So if somebody doesn't have the resources in hand, those are decisions that they can make to forego some of those payments. But it's going to be crucial that in 3 months, if they're out of work, they're not trying to deal with 3 months worth of bills and no income. And whatever attention we can give to help people understand how to prepare financially for that situation, and to budget, make sure that they're attending to their expenses, those bills, as much as they can now, so they're not accumulating. We can prepare them better to get through the next period until they're back up on their feet.
And I think some of these groups will continue to evolve. I mean, we're not going to say, okay, the pandemic's over and all these groups dissipate.
Right.
I think they're going to have to evolve and change into helping with these ongoing things, because it's going to take us a while to recover and to see our area bounce back and help our community members. But those are definitely good conversations. And I think, Debbie, did you raise your hand? So Debbie Ramsey is the executive director of Love Inc. And her organization kind of does these kinds of things all the time anyway. So go ahead, Debbie.
Well, thank you so much for bringing us all together. This has been very informative, and it's exciting, and just such a blessing to see how this community comes together. But actually, you addressed what I was thinking is, you know, a lot of our neighbors that we serve are, you know, our budgeting class is very basic, like, you know, what are your bills? When are they due? Things like that. But all of a sudden, they're going to have an influx of money, sort of like an extra tax check that's going to be coming. And, you know, we're just trying to figure out if there is a resource already established for budgeting, and to try to get them, reminders out that, there's still bills coming. There's still, you still owe your rent. You still owe these utilities, instead of us trying to come up with something. So hopefully that's going to be moving, because I feel like that a lot of people, it's like, whew, okay, we've got this money, but preparing for later is very important.
Yeah, and during a coalition call yesterday, that topic came up, and so we're getting the ball rolling on that. There are those types of resources that already exist, so it doesn't make sense to try to recreate that wheel. So those organizations that offer those types of educational opportunities around financial planning and budgeting are exploring how they can bring that to the whole community. So hopefully that's going to develop here very quickly and begin to make that available to everybody.
Dan, do you think that it'll be like on different levels of financial ability? Because like I said, for our neighbors, to think about investments or 401k, they don't even have that understanding. So it's going to be just basic, here is, here's what's due. Here's how you can pay part of it and don't let it build up until, it's due in 3 months, things like that.
Yes, and that was part of the conversation yesterday, is that we shouldn't be thinking about this just from the viewpoint of middle class, that we have residents in our community who have been dealing with issues of poverty long before this crisis came up, and they're underbanked, they're under-resourced, and we need to make sure that that education is geared toward everybody in the community, regardless of the financial background that they were experiencing before this began.
Yeah, I was gonna say, Debbie, I think you would be a great resource to help us figure out how to get that information out to those neighbors, because that is the population that you're serving already at Love Inc. As Dan mentioned on the coalition call yesterday, we did talk about the banks and credit unions. I know Carrie is on here. DuPont does a great job of financial literacy. I don't know if she wants to jump in and share about that any, not to put you on the spot, Carrie, but I know the banks and credit unions in our area do some financial literacy and do a great job. So those were the kinds of resources that the coalition was talking about being able to provide, but being able to hear from the organizations that serve those people, maybe the best way to get it out to them. I know Christy's VITA program is going to be really helpful, reaching out to some of those folks that they've been working with there to get those resources. It is important.
I don't know, Tammy may have, I think she was going to say something, so I don't want to take the floor from her.
Oh, no, thanks. I was just going to say that, I think that what is going to be challenging for all of us is that the needs that existed in the community prior to COVID-19 are still going to be there. Some are going to be exacerbated. Others are going to come to light because of COVID-19 and job loss and whatnot. So, it's going to take some folks like, is her name Lindsay that was talking earlier? It's going to take some folks like Lindsay to say, okay, we're ready to roll up our sleeves and get to work on some of these issues. So we're happy to have you along, Lindsay.
Awesome. Any other questions for any of the group? All right, well, hearing none, thank you all very much for joining us today. I really appreciate each and every one of you taking some time out. Like we said, we would so much rather see your faces in person, but Zoom is going to be the next best thing for now. We are planning webinars every week. So we have them planned through the end of April, and then we just started talking yesterday about some topics for May. So if you all have suggestions for some webinar topics, it can be dealing with the current situation or completely divergent from that. We're happy to entertain any topic suggestions. We do have a webinar tomorrow with Hansman Weevil, a CPA firm. A lot of you know Matt Hale. He's our current chamber board chair. They have a team of several people at their firm that have been really digging into the stimulus package, all the different parts of it, the Families First, the CARES Act, the Paycheck Protection Program, the economic injury disaster loans, all that good stuff. And they are tax professionals, so we felt like they were a little more qualified to dig into some of that than we felt comfortable doing. So if you haven't registered for that, it's on our website, or I sent an email this morning with the link to register. That's going to be some good information. So we hope you all can join us if you have questions there. If you're not able to join us, but you have questions that you'd like for them to cover, please feel free to email those to me, Courtney@AugustaVA.com. We'll be passing along those questions, and then that webinar will be available to watch later if you're not able to attend it live tomorrow. So thank you all so much. Thank you to Dan and Christy and Tammy for taking some time out of your very busy day. I think the three of us are going to be on a call a little bit later for our public-private partnership. So we'll get to chat again. But thank you all for your time. We appreciate you very much. I hope you have a great day. If there's anything that your chamber can do for you, we are working hard. We're working from home most days, but we are still working hard and here to serve you. So please let us know if there's anything we can do for you. You guys have a great afternoon.
Thank you, Courtney.
Bye, everyone.
Bye.